beautiful ladies. Yes, it's time to celebrate the 9 months of your pregnancy. I'm here to help you with these few suggestions to sail throughout the 9 months. So pregnancy is divided into 3 trimesters, as we all know. All 3 9 months are divided into 3 trimesters in frame of 3 months each. Let's start with the first trimester. So the first 3 months or the first trimester, we calculate it from the date of last menses to up to 3 months or 12 weeks. This period is extremely delicate as it is most of the formation period, developmental period is this one. In this period, fetus start developing its bones, cartilages, organ and their tiny limbs, hair. What are the do's and don'ts of first trimester? We'll discuss here. So what are the do's you as a pregnant female have to take care of are your diet. What you ingest, what you take in your diet plays a very important role. The second one is, and the most important is, to identify your doctor, to check what obstetrician or gynecologist you will be sailing through the whole pregnancy journey to avoid any emergency situation, and who will guide you throughout your journey. So it is very important to identify your doctor. Intake of folic acid it is very important to take folic acid in your diet because it prevents most of the neural defects and developmental defects in the baby, in the growing fetus, and including antioxidants in your food. So the diet should be clear, homemade and nutritious. It should be a balanced diet. It shouldn't be including any fast food. Most important is adequate rest. For the female to take rest and avoid any exhaustion is very important role in pregnancy to have a healthy mind and a healthy baby. One should include at least 1.5 to 2 liter of adequate liquid in their diet to avoid dehydration, as it is common during pregnancy as female feels nauseous and vomited most of the time. Then one should include antioxidants in their diet, like antioxidant fruits like oranges, apples, yellow bananas, blueberries. These act as a very good antioxidants and results in healthy mother and healthy child. Adequate rest is very important. Now comes to don'ts. What one should not be doing during pregnancy is self-medication. No pill should be taken during pregnancy without consulting your doctor, your obstetrician and your gynecologist, because it is very important to bring it into the notice of your doctor. What pills, what salts are you taking, because you may not be knowledgeable enough to take this decision, as most of the pills are prohibited during the time of pregnancy. The second thing is diet. What diet you are taking? Fast food, junk food, it should be avoided. Fried food should be avoided because it causes it can cause any infection. It can cause mother to feel more nauseous, and alcohol intake, smoking should be cut off from the diet in the whole pregnancy journey. Caffeine should be cut off from the diet of pregnant female because it causes malabsorption of nutritious food and causes the body of mother nutrition deficit. Now we will talk about second trimester and third trimester as a whole. So second trimester is the period. Second and third trimester is the major period in second trimester, which ranges from 13th week to 28th week. In this period, most of the cartilages and bones gains its functional maturity at this period. So it is very important to take high protein diet during this period. One should be taking milk products, calcium and protein diet during this period, and avoid stress, do meditation. One should be following a high nutritious diet, balanced diet, spinach and diet, milk products, high protein diet. Female should be sleeping on her left side, because sleeping on the left side helps in providing better circulation, blood supply to the baby, as sleeping on the right side can be done when the female feels little restless. So one should avoid sleeping on supine lying, that is on back, because most of the vessels supplying the fetus, the uterus, gets insufficient blood supply to the uterus, and so the fetus, which is detrimental to the fetus. And a female should be taking care of her dental hygiene, and they should be avoiding smoking, fast food, low nutritious diet should be avoided. Small frequent meals should be taken during the period of her third trimester, which is the more functional phase where a fetus gets its functionality at the time of third trimester. Healthy food, it avoids any infection or any weight gain which can cause eclampsia, that is hypertension, gestational induced hypertension, gestational induced diabetes. So it is very important to take care of all these things during this time period. Long travel, any exertion, exercise, it is very important for a female to take proper rest. Exertional activity can induce labor, preterm labor, and which will not be beneficial for the female and the baby. That's all for this. We'll connect on our next video for more updates.